This is episode number 300 of my podcast, and I am super excited to be recording this really special milestone episode. I have been at it, me and my team have been at it for 5.5 years, producing and releasing podcasts every single Tuesday without fail. And we have close to 3 million downloads. So I am thrilled that you're here. If it's your first time, if you've been listening for many years, or if you're like a few people that have listened to every episode, I would love to hear from you. Email us and let me know if you've listened to every episode. I'm thrilled to present here today, and I'm going to cover my 3 pieces of advice, autism advice, for parents and professionals helping toddlers through teens. So we all know the spectrum is very wide, but we are going to go over the top 3 big things that if you have a toddler showing signs or an older child or even a teenager who has moderate to severe autism and you're feeling stuck or you're feeling like you have obstacles, hopefully these 3 pieces of advice will help. So over the years, my team and I have answered thousands, probably tens of thousands of autism questions. And whether we are answering or commenting on YouTube, whether we're inside of our online community, our online coursing community, or whether we are coaching high-touch coaching participants, it really just all boils down to these 3 pieces of advice. So let's get to it. So as you know, if you've listened to a few podcasts or watched some videos over the years, I fell into the whole autism world in the late 1990s when my firstborn son, Lucas, who's now 28 years of age, he started showing signs of autism right after his first birthday, but I didn't notice it. My husband first noticed the possibility of autism when Lucas was 21 months of age and brought it up to me, and I told him I never, ever want to hear the word autism again. And I went into a deep state of denial. After his diagnosis, the day before he was 3, I went on to become a board-certified behavior analyst, best-selling author of 2 books, including my newest book, Turn Autism Around, and an online course creator. And that's really what I do all day long. I try to help people from, we have participants in our online coursing community from over 100 countries over the years, and we produce podcasts and videos, and we're trying to get the word out. And like I said, the answers, whether they're big answers or small answers, they all boil down to these 3 pieces of advice or 3 things to really look at. Okay, so advice number 1, tip number 1 is, okay, let's start with diving right in. So I have parents and professionals asking me questions and my team daily all over the internet and even in person when I run into people. So whether your child or clients are falling to the ground, hitting, not talking, not potty trained, not sleeping through the night in their own bed, whatever the situation is, whatever the question is, we want to take a 30,000-foot view. And tip number 1 is you always have to start with an assessment, and not just an assessment of diving right into the issue. When does he hit? How hard does he hit? How frequently does he hit? No, we're going to actually not even talk about the hitting immediately. Well, for hitting, we might talk about the hitting just to make sure we can try to get into a safe situation before we can even go up to the 30,000-foot view. But ideally, we need to get a snapshot of the whole child. When participants in our online course and community post questions like my child's hitting or flopping to the ground or not talking or there's an issue, it's always good for us to at least get the age and the general ability level. And the best way I know how to get the general ability level is to start with our digital assessment. So tip number 1 is to start with an assessment. And even if you have reams of assessments, my digital assessment, now called the Barbera Early Childhood Assessment, and BECA is is the acronym, BECA. At the time of this recording, it is still available at no fee, but that is going to change soon. So you do want to check it out and complete the assessment, especially if you're a parent out there. Now, if you're a professional, you are going to probably need the parent's help to complete the digital assessment. So anybody can go to marybarbera.com/assessment to complete the 10-minute digital assessment. We will also link that in the show notes here, and it's episode 300. So anything I talk about today, you can go marybarbera.com/300, the number, and you can find the show notes easily. So start with an assessment. The BECA assessment, like I said, takes a higher view of most of the issues. When you take the BECA assessment, then you get a printout over your email address, and you get scores for the child in self-care, picky eating, sleeping, potty training, grooming, dressing. You get a score in language and learning skills, and you get a score in problem behaviors. So even if your question is about potty training, we need to know, and the BECA will tell us, the age, the general ability level in these 3 main areas, and so that we can really see if it's, a potty training issue, but the child's only 2, and they're not talking and they're flopping on the ground, then potty training it might be your number 1 priority, but the child is probably in need of looking at the other areas in addition to or instead of potty training, so that we can really get the right skills in the right order going. So just like anything else, if you have a plumbing problem or if you have belly pain, you're going to need an assessment. And luckily, this 10-minute digital assessment will really give you a snapshot so that you can figure out your child or client's strengths and needs. There are 4 steps to the Barbera Method, the same 4 steps to the Turn Autism Around approach, the same 4 steps to the verbal behavior approach. It's my method that I developed over the past 25 years. There are 4 proven steps: assessment, which is our tip number 1, planning, which we'll take the assessment and make a plan. Then the 3rd step of the Barbera Method is to teach or intervene. And the 4th step is to use easy data to make sure that you are making progress. Now, the BECA assessment is not the only assessment that I would recommend. In my book, Turn Autism Around, we can link that in the show notes, how you can start reading that for free. We have other assessments, and in our online course, we have other assessments where we guide you through language samples, through taking videos, so that we can really tell if your child is making progress based on the intervention that you're learning in my online course and community, and or the intervention that you're using outside of my approach. So you don't have to use my approach to take advantage of the assessment. And we are seeing within our course and community very good transformation, very good pre and post scores. The BECA is not validated or reliable yet, but with over 50,000 people taking it over the past 2 years, we are seeing very good trends. Like I said, very good pre and post scores, and very good guidance for parents and professionals to make sure they are focusing on the right things in the right order. So the first piece of advice, whether you have a toddler through a teen, whether you're a parent or professional, whether there's even a diagnosis of autism or not, is to do the Barbera Early Childhood Assessment, or the BECA. The second piece of advice or thing to look at if you're having any kind of issues with a child with autism or a toddler showing signs is we need to focus on prevention of problem behaviors, pairing, and reinforcement. When I do lectures, live lectures, and we discuss kids with autism and toddlers showing signs, I ask, what behavior do you want to change? Write it down. We can even do it here quick with you listening. Okay, think about if I say, what's one behavior you want to change? So you have that in your mind. And when I do it with live audiences, 95% or more of the parents and professionals in the audience write down that there is a behavior they want to reduce. They want to reduce hitting or crying or whining or grabbing, or they want to reduce or eliminate the child darting away, refusing. So when we are in that mode of wanting to reduce things, we can't reduce these problem behaviors without, as behavior analysts call it, replacement behaviors. What I call it is we need to look at problem behaviors as one side of a coin. The other side of the coin is increasing the pro-social behaviors we want, increasing talking, increasing imitation, social skills. What behavior do you want? So, and then once we do the assessment as tip 1 and get to prevention of problem behaviors, we want to spend 95% of our time on the side of the coin that's not reducing problem behaviors. In my course, I talk about, say you have a hole in your roof, and you're getting, when it rains, you're getting not just drops, you're getting real water flowing in. So instead of saying, okay, well, we can't count drops, let's count bucketfuls of water. No, we have to fix the roof. We have to prevent the water from getting in. So the second piece of advice is we need to, whether we have a toddler or a teen or someone in between, even for our typically developing kids, for our spouse, for our coworkers, we need to use a few key behavioral procedures. One is we want to spend 95% on prevention. The other one is, in order to do that, one of the tips is use 8 positives to every negative. This is for everybody. Everybody wants to be in a positive environment. So we need to be a lot more positive. So if you have a child who's biting, screaming, flopping on the floor, go back to the assessment. And in addition to the BECA and the other assessments that I talk about in my book and my courses, I also have in my courses a case study template. We talk about ABC data and problem behavior templates. And unfortunately, if you're a parent out there listening and thinking, I don't want to get all into that, like I want to leave it to the professionals. unfortunately, kids with autism have problem behaviors and need language coaching and training throughout their day during most of their waking hours, which for most kids, that's 80 to 100 hours a week. So I wouldn't rest on your laurels and think, oh, well, we have 20 or 30 hours of ABA, or he goes to school and, we're covered. We're good. I don't need to dive in. I don't need to roll up my sleeves. I'll be, quote unquote, just the parent. But I have seen over the years, and studies have proven this too, that the more involved parents are, the better the children will do. And if you have any kind of problem behaviors, with or without professional help, I would really recommend that you look into my course and community. So, as I said, the key to reducing or even eliminating major problem behaviors is prevention. We want to focus 95% on preventing. So in general, we want to say yes a lot more than no. If the child is constantly after outlets or climbing up the steps, we want to use outlet covers or gates. We want to be the spoiling grandma when the child is being, quote unquote, good, when the child doesn't have problem behaviors. And then when the child does have problem behaviors, we need to not be the spoiling grandma. We need to change our tone. And there's a couple key things that I would do, which I outlined in an episode on how do you stop hitting and throwing, which we can link in the show notes as well. So number one piece of advice is always start with assessment, and the Becca assessment is the best place to start. Number two, focus on prevention of problem behavior, pairing, and reinforcement. And the third piece of advice, which I see both parents and professionals struggling with, is it's going to take a team. Whether you're a parent listening, you need to work with, if it's a two-parent home, with your spouse or your partner. You need to work with the early intervention professionals and with the school personnel, with the soccer coach. And if you're a professional out there, you need to work with other professionals in a collaborative way. You need to work with parents. Even if your child just has a speech delay, you will most likely be working with at least one professional to help you. So I really applaud everyone that is listening, whether you're a parent or a professional, but we really need to think about strategies that can work. For professionals out there and for parents, if you go to private speech therapy or occupational therapy or an ABA clinic, make sure that the transition to the clinic is smooth. If it's private speech therapy or OT or even ABA therapy, maybe there is two-way glass you could watch through. Maybe you could attend in person with the child. I have stories from some of my members who, they get off a wait list and they drive to speech therapy and it's like an hour away. And then they're told to wait in the waiting room, and the child has separation anxiety, and it's just, that's not going to do anything. If the child's crying, the child's not learning. I did a whole episode on that recently. We can link in the show notes. So we need to involve parents, especially parents who are the type of parent that would be listening to this podcast. We can't shut out gung-ho parents because they will be with the child now, they'll be with the child next year, they'll be with the child in 5 years, and they're going to need to learn to be their child's best teacher and advocate. And if you're a parent out there, always think about, how can I have my spouse learn this? How can I have my babysitter learn this? How can I pair with the ABA therapist or the speech therapist so that we are all working on the same goals the right way in the right order? One of the high touch coaching participants that we've had, a few of them have had kids that do well with mom, and maybe a nanny or a grandparent, but even they don't do well with dad because he's at work most of the time, or they don't do well. They have, meltdowns when the professionals come. So in that case, we have to pair up the stranger or the less familiar person with reinforcement. So for one of our participants, I suggested that they have a special bag of toys, and some professionals are not even allowed to bring in toys from house to house, for germs and also for a lot of reasons. But you could have a box or a bag of toys in the mudroom or in some part of the house that when Susie, the therapist, gets there, she knows to get the bin or to get the bag, and she walks in with the bag or the bin so that the parent doesn't just exit the room and the child's not comfortable. So the child and the therapist will sit down and really have fun with the toys. But instead of mom taking over in that point, mom's already highly paired. We want to get the other spouse or the therapist paired up, hopefully as close to mom as possible, so that mom can leave the room. Mom can do other things, so that they can get the full amount of therapy. But we can't have a new RBT coming in that doesn't know your child and doesn't really know anything about how to, work with your child and then just let them on their own because that's their role. So I think we need to leave our egos at the door and really think about what the child needs. The child needs to be in a calm, happy state, and we all need to be putting procedures in place that are preventative, positive, fun, and really work together to help the child reach his or her fullest potential over the months and the years that we are working with them. So I hope you enjoyed those 3 pieces of advice. I really do think that, especially if your child is young, now's the time to put these procedures in place. Really, don't just listen to podcasts over and over again. The paid course and community is really where you need to be. We had a participant, Ruth, who was previously interviewed on the show. We can link her in the show notes, but she was so excited when I was at episode 200. So a while ago, she was so excited to come on Zoom and tell me that she had listened to every single one of my podcasts. And later, I calculated that was about 165 hours of free content. Yet her child was now 5. He wasn't talking. He had some pop-out words. And so while she was able to get him potty trained and get him sleeping better and make some progress with free information, I told her on that day that I really thought she should join our course. And now she's joined our course, and she's basically purchased every offer that I've ever given because she knows that there's real power in learning all you can. And not just piecing together free information, because it is tough, and kids are so different. So number 1, start with an assessment, and the Becca assessment is, in my humble opinion, a really good place to start. marybarbera.com/assessment. Number 2, focus on prevention of problem behavior and looking at the whole picture. And number 3 is working with family members and professionals to help each child reach his or her potential, whatever that is. And that keeps changing and that keeps growing, and we keep moving the bar. So it's been a real pleasure to produce 300 episodes for you all. And if you're here till the bitter end, thank you so much for your support. I would love a comment. I would love a review. Email us and let us know what you like, what you don't like, and we will keep producing as long as possible. Have a great day.